COVID-19 is the most prominent health threat in society today, but the Minister of Health says other diseases have not gone away. As such, he reminded parents at today's Ministry of Health press conference that they need to keep up with immunizations for their children to protect them against the normal health threats they face.
What we notice in other countries is that the immunization program tends to fall off. And what we don't want in Trinidad, while we deal with COVID, to have an outbreak of tetanus, measles, mumps, rubella, polio, whooping cough, diphtheria, yellow fever. All these childhood diseases, which can have grave consequences, can be mitigated by vaccination.
The minister also reminded the nation that HIV/AIDS clinics remain open for use.
Take our eyes off is that of HIV and AIDS. And I urge every citizen who is on HIV therapy, our HIV clinics, our services are open, up and running. We don't want to reverse the gains that we have made in keeping our HIV/AIDS numbers down. So take advantage of our open clinics, our open facilities to deal with HIV.
Technical Director of the Epidemiology Division at the Ministry of Health, Dr. Avery Hines, has refuted a newspaper report insinuating that COVID-19 was in this country prior to March this year. The newspaper report cited a number of deaths as a result of respiratory illnesses late last year into this year, but Dr. Hines dismissed this idea. He explained that the data was poorly used and not properly analyzed.
Now, this is dangerous use of data. It is not the appropriate way for mortality data to be used. And we don't expect that the persons who put the information into the public domain are aware of or are trained to do that. But what we do expect is that the persons who are aware of and who are trained in the use of data be allowed to produce useful information from the data at our disposal and present that as an authoritative source.